Hello, this is Dr. Sergey Sorin, and instead of today's radio program, Wellness Wednesday, because of the weather, we are dealing with a situation where people just can't get to the station. So I'm here in my office, and we're actually going to broadcast on Facebook Live and YouTube Live. We're still going to talk about the same topic, and it's going to be related to aldosterone. Aldosterone is one of the most important hormones, especially when it comes to several things. Blood pressure. A lot of people have hypertension, blood pressure out of control, but also weight, water retention, and many other issues. So as we move on, I would love to have questions, suggestions, any topics, any question, anything that comes to mind. Send us a request or any kind of question, and we'll see if we can address it, answer it. And I'm hoping that everybody is with us, or as you join, as the program comes in, you join us along. And let's talk. So, aldosterone. Aldosterone is one of those hormones that is actually found in the body, and it's one of those very important things that is essential for hypertension, blood pressure. There's a number of drugs, medications that related to the control of aldosterone and proper homeostasis of aldosterone in terms of regulating the blood pressure for those individuals who have hypertension. But it also serves many other purposes, including aldosterone is responsible for the water balance in the body, excessive water or not enough water. And since human body is made primarily of water, over 70% of what we are is water. It's a very, very important, essential topic. So how do you work with aldosterone? How do you increase that other than taking synthetic drugs, medications, and otherwise? And by the way, we'll talk about hypertension, blood pressure, and what to do if you have that naturally, safely, effectively as well. One of the key aspects of bliss oils, transcutaneous acupuncture, is there's 5 rings. There is a ring of air, which focuses on normalizes neurotensin, oxytocin. Those are the feel-good, I'm okay type of a hormone, and it's very important for well-being and wellness. Another one is with the earth bliss with calcitonin, and we haven't gotten to that one yet, but that's going to be a good conversation. That's bone health, calcium metabolism, but also pain relief for those with musculoskeletal issues. Then there's also a ring of crystal that we addressed during the previous show, which works with free radicals, those scavengers that, they destroy our bodies if uncontrolled. And there's a way to work with free radicals, including with transcutaneous acupuncture, application of bliss oils to the skin. No needles, 30 seconds per ring, wonderful, easy modalities, and it works. So this topic, aldosterone, is very close to my heart. Many people, many patients, many clients have water retention issues, weight management issues, but also uncontrolled blood pressure. Frequently 3 or 4 drugs, medications that don't seem to do the work and create all sorts of side effects. And the concept behind a side effect is, and I want to be very clear, actually, let's see if we can make things a little better. A side effect to a medication is not a benign entity. So when a person has a side effect, and if you look at any kind of a medical literature, just look up aspirin, Tylenol. There's going to be a list of potential side effects. Those side effects can be very harmful. Anything from, in men, erectile dysfunction, and in women, many other issues as well, to lack of energy and lots of other issues. Holistic approach, or holistic meaning everything, takes into account not only the conventional, and we do honor and respect the conventional. There's nothing wrong with conventional in an acute setting, especially if it can save a life. As an emergency room practice, one of my primary responsibilities is to stabilize a person. And if somebody's blood pressure is, through the roof or in a very dangerous area, whether it's high or low, I got to use drugs and medications to stabilize the person. And that's okay. But if the problem continues for, say, 6 weeks or more, and especially for months, and the person ends up taking chronic medications, and usually those medications get higher doses and more of them. Average blood pressure regimen, for example, is 3 or more drugs with approximately 45 or 50% effectiveness. But there's almost 100% on the side effects. In other words, negative reactions from the drug. So how do you avoid that? How do you deal with that? Let's talk about some basics. Before we even get into anything else, aldosterone can be easily normalized using the ring of water. Ring of water is applied simply by taking a bottle. It's about the size of a finger, and then you just apply it to the point. Not this point specifically, but there's 12 points that you can go from the feet onwards. And it takes 30 seconds once you get really good at it. The benefit is it helps with blood pressure, it helps with water, fluid retention, and it really does a fantastic job in where lots of the other things have failed, conventional medicine. And by the way, conventional medicine tends to fail quite a bit more than most people realize. It's actually, I would rename it from conventional medicine to disease-based medicine, or disease. It's a focus on what goes wrong. It's a focus on pathology process. So if a person is looking for wellness or to get off medications and drugs, you've got to come from it from a completely different holistic perspective. So what does holistic perspective in terms of the fluid, water balance, and blood pressure look like? Let's start from the very basics. Lifestyle. Lifestyle is one of those essential things that I'll keep talking over and over and over again until everyone gets that, or until I haven't, until there's no longer need to talk about it. And so far, there's always a need to talk about it, because there's always something we can do better. What are some of the lifestyle factors? Weight. Let's start with weight. You take your height, you take your weight, and there's a formula by which you can get to something called body mass index, BMI. If the body mass index is anywhere from 18 to 24, you're in good place. That's an optimal body mass index. Now, some people may be over that or under that, but again, depending on their body type. If a person is 25 or 26, let's say up to 27 body mass index number, and they're very muscular, there's muscle weighs more than fat tissue, that's fine. But if a person has increased adiposity, or in other words, increased fatty tissue, obesity, overweight, that causes more problems than just what meets the eye. That it's a risk factor for many issues, including diabetes, hypertension, and the so-called syndrome X that we learned in medical school, as a matter of fact. Why do people why did in conventional medicine we call something syndrome X? It makes it more mysterious, let's put it that way. And it makes it sound like, we don't know where it's coming from, we don't know how it comes around, but it's a syndrome, and we're familiar with that. And in order to treat that, you need more drugs. Actually, as a matter of fact, it's a very simple phenomena. Syndrome X, which is hypertension, sugar intolerance or diabetes, whether it's frank or something called prediabetes. By the way, prediabetes, I don't use the term whatsoever. It's the question on those things is there's prehypertension, prediabetes, and all it does, from my perspective as a holistic provider, is to minimize the importance of something that is already wrong in the physical body. Dis-ease. Once you've gotten to that place of dis-ease, lack of ease, you know there's an issue. And just like I wouldn't tell somebody, or I wouldn't, doesn't make sense to hear, I'm just a little bit pregnant. You're either pregnant or you're not pregnant, so to speak. So same way, if you've been told that you have prediabetes or prehypertension or any other chronic preconditions, take it seriously. Reverse it, especially if you catch it early. It's so much easier to address and to handle. So lifestyle is one of the key components there. We talked about body mass index. How do you work with body mass index? Let's say somebody's overweight. How do you get down to a better weight? But also, very important, nutrition. Nutrition is a factor in weight and body mass index, but it's a factor in itself, including what kind of foods does a person eat. Is it junk food? Is it poison that we are putting into our bodies? And frequently, as a matter of fact, most of the foods that we're actually putting in our bodies is pure poison. If you walk around the supermarket, the exterior is generally your veggies, your meats, your protein. The inside of a grocery store is generally crap. I don't know how else to say it, but it's generally crap. It's sugar, it's the sweets, it's carbohydrates, it's processed stuff. And that is what's killing us. And not only is it responsible for excessive weight gain and water weight gain, by the way, that's where the aldosterone kicks in. But it's a predisposition to many other issues. It's basically taking poison and putting in your body and seeing, hey, how long will the body tolerate that? And that's an issue. And that's a very easy decision to get to. Do you want to take care of yourself? Yes or no? And if you do want to take care of yourself, then please do. There's one of my favorite quotes from Star Wars by a character named Yoda. It's a little creature, very wise, by the way, and powerful, but likes to talk in riddles. And one of his statements is, do or don't. There is no try. So when I have people tell me, oh, I will try to change something, the bottom line is, are you willing to or are you not? It's as simple as that. Once you get past the lifestyle, of course, you get into some other factors. What are the other ways that we can work with blood pressure, with water balance, we mentioned the transcutaneous acupuncture, ring of water. That's one very effective way. But what about some general supplements? What is a regimen that we recommend for people with chronic hypertension, blood pressure, and water issues, edema, and otherwise? Well, first and foremost, you got to have a good basic multivitamin. And lots of multivitamins out there are not worth anything, literally. It's a B complex is one of the most important factors. You want to make sure you have 25 to 50 milligrams of most Bs, especially B6, especially when it comes to the blood pressure and water balance. But what you're doing is you're hydrating the cell. You're giving nutrition to the cell. It's an energy. Without energy, the cell cannot produce, and we have trillions of cells in our bodies. So this is truly an essential. With the essentials, which is a multivitamin with with the minerals and others, just to make it a complete good multivitamin, usually 2 per day for most people, 2 per day, is something called, it's a combination of vitamin C, molybdenum, MSM, and beta-1,3-glucan. That combination is what makes Dr. Shealy Youth Formula. And that was something that was derived based on the fact that not only does it supply 2 grams of vitamin C, which is wonderful for the immune system. But it does something else. It raises the level of DHEA, dehydroepiandrogenase, one of the most essential health hormones that balances the cortisol and the stress cascade in the body. It's the uncontrolled stress which is responsible for over 85 to 90% of everything that happens in the human body, everything that goes wrong, including physical, mental, and emotional aspects. Depression, anxiety, all sorts of chronic medical illnesses. So if you want to stay healthy, you want to keep pay attention and become aware of these things. Now, let's continue. What else do you need to optimize in terms of if a person has blood pressure issues or water retention issues? Well, vitamin D. Vitamin D is a good general recommendation whether you have those issues or even if you don't, just for general good health. But with any sort of medical condition, you want to make sure that you take plenty and enough of vitamin D3, not D2. D2 is a precursor and does not always translate into D3, which is a functional aspect. And the amount of D3 is very important. What you see out there is 1,000 to 2,000 international units I use. That's not enough. That's a drop in the bucket. You want 50,000 at the very least. 50,000 international units of vitamin D3, and it can come in a little capsule. You take it once a week. And if you ever get sick, you can actually take 3 of those, or 150,000 international units. And by the way, if you try telling your doctor about this, conventional doctor, they'll probably go, berserk, because most people don't understand what the issue with vitamin D is and what is enough and what is not enough. As a matter of fact, vitamin D deficiency, small little aside, is responsible for most states of dis-ease, lack of ease. It's very rare for somebody with good levels of vitamin D to have lots of medical chronic issues. It's nearly impossible. Another thing that helps with blood pressure, with just normal healthy being, but also especially with blood pressure and water balance, is magnesium. Magnesium is deficient in the soil. Magnesium is used to be present in the food supply. It is no longer. Animal farmers now know better, and in order to keep their livestock alive and well, guess what they have to do? They have to supply magnesium to their animals. The best way to deliver magnesium, by the way, is through the skin. It's not to take it by mouth. So humans, compared to the animals, we are actually, animals are doing better than humans in that respect, because at least the farmers are aware of that. If humans were aware of that, we wouldn't have as many issues as we normally would do. And magnesium topical can be a cream or could be a spray. If you're going to use a cream, Dr. Shealy's formulation, which also raises DHEA, by the way, by another 60%. The first one was vitamin C and a B complex, youth and essentials. But coming back to the magnesium, transcutaneous magnesium, in other words, applying it through the skin, thicker part of the skin, I wouldn't put it in your eyes. It can burn. Doesn't do any long-term damage, just unpleasant. But that is one of the other ways to increase DHEA, dehydroepiandrogenase, which is an anti-stress hormone. And it does really well for people with hypertension. And last but not least, if you have blood pressure, if there's blood pressure is still not normalized with those to start with, another thing that we use is something called taurine. Taurine complements all of the above, magnesium and vitamin D and B complex, vitamin C. It's everything that we're talking about. It's a package, and as a package, the whole is the greater than the sum of its parts. In other words, you get more benefit out of taking things in that combination than if you were to take one by one individually. The body is pretty wise in that way. The taurine, I recommend anywhere from 2 to 6 grams per day. And taurine can be taken at, let's say, 2 grams 3 times a day, up to 6 grams per day, in case a person has uncontrolled blood pressure. It's very effective. It's wonderful for the central nervous system. It stabilizes the cellular charge, and it's one of the essentials that, well, keeps our cells in functional order. If you have to go beyond that, if you have to go beyond those, the next step is, well, it's called Nitro Extreme. Nitro Extreme is, let me see if I have the bottle here. Pardon the interruption, but this is what it looks like. Oops, here we go. I'll bring it closer to the camera. Oops, can you see that little concoction? This is my personal one, and its nitric oxide is fantastic for several things. It normalizes, it normalizes blood pressure. It normalizes the vascular flow. It doesn't increase or decrease necessarily like, for example, synthetic drugs do, because you can actually lower things too much if you're not careful with drugs. That's part of the side effects. What Nitro Extreme does is it's a derivative from a noni fruit, and it completes the regimen that we use for hypertensive and vascular issues. It's also great for the energy. It's good for the brain, and it literally makes you feel like you're on top of the world. It's a wonderful alternative to, there's lots of the 5-hour energy drinks and otherwise, which are not always healthy for you, especially if you look at the ingredients. So if you have a choice, if you have a question on what to do, what to take for energy, but you also have the blood pressure issue, consider Nitro Extreme. One other very important topic, another aspect, is mental and emotional control, self-regulation. Interestingly enough, I just mentioned a lot about the supplements, but from time to time I get people who will tell me that they either are not interested in taking supplements, which is, again, I don't understand if something is helpful, why you wouldn't want to do that for yourself. But I understand there's other factors, perhaps cost and otherwise. If you really can't afford or really don't want to take anything, then one of the first steps that you can go to in terms of the blood pressure control, but also in terms of essential self-regulation, is something called autogenic training. Autogenic training is it's the initial exercise. It's an MP3 that you can download, part of the Biogenics self-regulation system and stress management system developed by my medical partner, Dr. Norm Shealy, as part of his 1970s humanistic psychology PhD project. And that is a wonderful, wonderful modality for controlling not just the blood pressure, but the entire autonomic nervous system. Autonomic nervous system meaning sympathetic, which is your activation of stress, and parasympathetic, which is relaxation, and then you can come down to normal level. The way I explain to people about autogenic training, and you may have heard me mention this, is it's one of the most powerful, amazing self-regulation techniques. And when I talk to my clients, and I had several of such conversations in the office, in the clinic, it's just such an easy, amazing modality. It takes 18 minutes a day, 6 repetitive phrases. My arms and legs are heavy and warm. My heartbeat is calm and regular, like a grandfather clock. My breathing is free and easy. My abdomen is warm. My forehead is cool. My mind is quiet and still. Each of those phrases, by the way, is a progression in terms of self-hypnosis. And the key here is that you want to get to the place that you can actually learn this network and learn this sequence, so that whenever you're under stress, or even as a default mode, your body, your mind will actually register stress, become aware of stress, and correct the stress. When I work in the emergency room, one of the most common things that I see, as well as in the office, is people coming in for blood pressure that's not controlled. And the interesting thing about it is that frequently I see this folks, and they can come in with a higher blood pressure, perhaps more than their usual. But if they keep looking at the number on the screen and they keep stressing over it, I guarantee, and I demonstrate how they will actually raise that even more, to even more dangerous levels. And it becomes a snowball effect, literally. A snowball effect, meaning that stress and anxiety over blood pressure leads to higher blood pressure, which leads to higher level of stress and anxiety, and then onwards and so on we go. So what do you need to do in this kind of situations? Well, if I'm in the emergency room, I can push some intravenous drugs, synthetic drugs, I should say, and I can bring it down, the blood pressure. I can also give anti-anxiety medications, or like Xanax or Ativan or things of that nature. And again, part of the holistic approach is you got to use all sorts of tools. And in the emergency room, I don't have the luxury of talking about and dealing with things that I'm talking about now, because this is truly, truly preventive. So if you really want to be healthy, you want to be self-regulated. This way you avoid emergency rooms. You don't really need to be reliant on your doctors, on the medical system, healthcare system, sick care system. Now, I'm not saying that if you should avoid that at all costs, or if there's an issue that you don't go. That's not at all. That's not what I'm saying whatsoever. There's a place and a time for everything. And if you need to, of course, address something before it becomes too much of an emergency. But if you can keep yourself well, hydrated, in a good place with lifestyle, stress management, chances are you're not going to have any or significant medical issues. And even those with medical issues, such as blood pressure and diabetes, water retention issues, edema, you can actually live a good quality life without having symptoms. You can reverse those medical conditions. That's what I'm talking about. That's what we do in our practice, and that's what we strive for. We get people off medications and drugs. But more important than that is, the point is beyond getting off drugs. The point is that you want to be self-aware. You want to be self-regulated. You want to be, for example, if you were to be on a island by yourself somewhere without any medications, without any resources, you want to be okay. You want to be able to handle whatever comes your way and not have to rely on external factors. Though that is what I'd like to address during this conversation. And if we have any questions or any other discussion that we'd like to address, I am certainly open. And please send the questions and comments or thoughts, and we will talk more. Speaking of one more thing that I'd like to mention is autogenic training is a very powerful technique, but it's part of the even bigger system, Biogenics. And right now, Biogenics is still on a very significant special at $97, which is well over $1,000 value. Over 68 various exercises on self-regulation, physical biofeedback, in other words, getting feedback to the body and from the body, mental and emotional. One of the most powerful, amazing things is, for instance, is tolerance, forgiveness, and acceptance. I'll say it again: tolerance, forgiveness, and acceptance. And I'm not saying you're doing this for anybody else. The goal is to be able to see and to do that for yourself, no matter what has happened in your life. That's, again, part of the mental and emotional components. But there's also other components, such as, who am I? And that's very important to understand. The trouble with the healthcare system is that since for several hundred years, ever since Cartesian separation of the mind, body, and spirit into categories, into boxes, and removal of the spirit, and putting this mental and emotional into a category of psychiatry, which is a very narrow field, which doesn't succeed very often because, again, a human being is not meant to be isolated. That's the concept of holism, mind, body, spirit. So that's why we're here, to take the emotional, mental, spiritual, the entire being, the entire person, put it back together, and this way we come back from dis-ease back into ease, or reversible medical conditions, and issues. And if there's any questions, I am happy to take that. Let me actually look over and see what we have so far. Yep. Please feel free. Questions, comments, and I'd love to hear from you, and I'd love to address anything that you have in mind. Okay, where do you recommend to put magnesium lotion on the body? And is it supposed to be very itchy on the skin? It can be. It can be. You don't want to put it in your eyes. So when you use magnesium lotion, you want to wash your hands really well with water and soap. And then you can go ahead and do what you got to do. What I do with magnesium lotion is personally, and I recommend this to clients, and again, magnesium is best through the skin. You avoid bypass through the liver. It's called, that's where a lot of magnesium gets deactivated, and it's not well absorbed in the GI tract. So you take it and you put it on the thicker part of the skin. You can put it on your arms, your legs, but the easiest way, take a bunch, it's about 4 teaspoons, and then put it in the buttock area, pull up the underwear, and there you go. And could it potentially itch? Yes, I've heard people say that, but compared to the benefit of what it does, it's incredible. So the pros definitely, cons minimal. That how I look at it. Wonderful. Any other questions, thoughts, or anything else that you'd like to know? Excessive burping. Got you. Okay, that sounds like a type of a reflux type of a situation. GERD, or now could be other reasons as well. First and foremost, this is what I love about the digestive health. Now, in case you may not have heard me about this, I have a personal interest in digestive health since my own colon cancer personal history. So that taught me to become very aware of that organ system. And I'm in full remission, so it's just a wonderful way to get those lessons. If somebody has excessive burping or reflux, first of all, make sure that you take a good digestive enzyme, because one of the reasons why there's burping is because there's a gas formation in the GI tract. And if the food that you take is not properly digested, processed, or made use of, then what happens is that food, that nutrition, instead of you using it, it goes to the bacteria and other organisms that are in the GI tract. There's actually more organisms in the GI tract, including fungus, fungi, bacteria, viruses, all sorts of things. And they can be, they don't necessarily have to be a bad thing for you. We are a symbiosis of many different organisms, trillions of cells, human cells and non-human cells. But preferably the biome is friendly. And if it's not friendly, in other words, if it's there's a dysfunction, then you have to really clean up the GI tract as much as you can. So one of the things that works long-term is autoimmune X. It's one of my favorites, and but it does take 3 to 12 months to take effect. I co-authored a book called The Code of Life. And it talks about all of the properties of autoimmune X, including the cellular nutrition, communications, many other ways, many benefits. The other thing is something very simple is Gas-X, Simethicone. And that's a very easy formulation you can get from a pharmacy over the counter, and you don't need a script for that. That's a good way to start. Now, if the excessive burping is continuous and ongoing, well, then that will necessitate a visit and evaluation, because there could be other things like H. pylori, which is stomach issues, and, well, lots of other possibilities. I hope I addressed that question to some degree. Okay, let's see, the next question. Suffering with grief, need to lose weight. Already doing Biogenics 2 times a day. Wonderful. Thank you. Using magnesium and youth formula. Fantastic. How many ring treatments with bliss oils can you do a day, understanding that I need more than one? You can use it twice a day or more, but from what we have done, the research, the rings can be done up to twice a day. We haven't had anybody demonstrate by research, or we haven't done the research with more than twice. My personal observation is I wouldn't necessarily do more than twice a day as far as the rings. Now, grief. Grief is a very important topic, because every thought is a prayer. And many people actually respond to grief and stress. Stress is behind 85 to 90% of everything bad that happens. And the weight is usually a function of excessive stress hormone, cortisol, and otherwise. So normalization of that is very important. Autogenic training twice a day is a wonderful thing, but I want to make sure that when you do this, you don't just do it just to listen to it. Even though there may be benefit, make sure that when you do autogenic training, that you do so with the intention of owning it. You want to own that. And what do I mean by owning it? When for example, if I were to go through the phrases, my arms and legs are heavy and warm, my heartbeat is calm and regular, my breathing is free and easy. And the very second that I say the first phrase, I already feel the entire thing. I can get into a place of, I feel better. That's called in training. That means I own it. And it takes 2 to 3 months of continuous training for that in order to become automatic. So in other words, it's a tool you want to own. Now, there's also the rest of the biogenics, and especially dealing with grief and getting to the bottom line. I'd say one of the most important things in the Biogenics program, and please, if you haven't taken up on us on a special offer for the Biogenics, please do, is tolerance, forgiveness, and acceptance. And you're not necessarily forgiving somebody else, or you're forgiving the circumstances, you're forgiving yourself. You're letting go of the garbage, the crap that doesn't belong. You got to be free. You got to be free mentally, emotionally, physically. Magnesium is fantastic. Youth formula is fantastic. But in case, if there's a need, if there is a desire, we can also do a consultation. We specialize in anxiety, depression, pain, and chronic disease. This is getting things back. So that's another step. But if you want to start with what I suggested, that's a wonderful option. I hope that was a good introduction there. And thank you. Wonderful question. Where do you source your essential oil blends? Are they tested for purity? Yes. Our oil blends come from India, the highest quality of oil, and it's a proprietary blend that goes to make each bliss oil. Each bliss oil is a combination of carrier oils and some active oils. And people ask me, so which oils go into it? I can't disclose that because that's a proprietary blend, but I can tell you that it works. And we've done research. There is science behind it. It's the entire thing is scientifically tested, proven, and that's how we can make those statements. We wouldn't otherwise. Thank you. Once you listen to the first 47 videos in the Biogenics training, then what is left is the 45 autogenic MP3s. Is that correct? 68 MP3s. Yes. You start with autogenic training. That's like the tip of the spear. And you do that for 3 months in a row, 2 to 3 months, until you own it. That's the key. Once you have that, and once you start with a couple of days of that, you want to add some of the other exercises. And we can certainly guide and advise and for your specific situation, but there is also a specific order that we'll be mentioning in the Biogenics course that is generally good for most people. And what you want to do is you want to listen to each exercise at least once or twice. It doesn't take much time, but you'll know which ones are right for you, because there's different categories. There's category for physical biofeedback, and of course you got to start with the body. If the body is not feeling it balanced or at rest, it's kind of hard to focus your mind and brain if you're hurting or if you're uncomfortable or tense. So that's the first step. But not to forget, mental and emotional. Every thought is a prayer. And I mentioned forgiveness, tolerance, acceptance, and there's working with an emotional body, working with your, how do you work with stinking thinking, so to speak. Every thought is a prayer. And of course, things, exercises such as, who am I? What is my purpose? For instance, I have a physical body, and I am more than my physical body. And I'm more than my physical body. It's not mind versus body. It's not mind over matter. It's mind and matter. We have all these things, and we're more than that. And of course, we're spiritual beings with a physical, amazing physical component and fascinating mental and emotional components. And to master that, now that's a blessing. That's a life well worth lived. So that's that. Do you have suggestions for excessive nausea? Use a lot of ginger, meditation, tapping, and trying to stop Zofran. Okay, fantastic. Zofran is a medication. I use it frequently in the emergency room and in my practice, and it does help to stop nausea. It's one of the agents that works on the central nervous system, and I'm quite familiar with that medication personally. When I was going through chemotherapy initially, I did a few treatments when I was diagnosed with colon cancer, so I'm familiar with really high doses of Zofran, because the stuff that was thrown at me chemo-wise was just, well, it did a number on everything, including the GI tract. So I'm very, very much familiar with that. Zofran is a Band-Aid. I'm glad you're mentioning that. Why do people have nausea? Now, nausea is actually one of the most fascinating, one of the most interesting symptoms that we work with, because it can come from gastrointestinal tract. It can be cardiac. In other words, people with heart attacks can have sometimes have some nausea. Now, of course, it wouldn't be excessive nausea on a regular basis. It'd be a sudden acute episode, but it could be a sign of infection, such as kidney infection or something going on in the blood. It can be a sign of hormonal imbalance. It can be a sign of so many things. So number one, and first and foremost, you have to get to the underlying cause. Why do you have nausea? This is where conventional medicine does shine. This is where a consultation is priceless. Priceless. And again, it's if you can get to the bottom of it and eliminate the underlying cause, problem solved. It is fantastic. But and if of course, feel free to reach out. We'll be happy to address any questions clinically as well. And this is where it gets into some personal factors, because it's beyond some general advice. Meditation is fantastic. Ginger is fantastic. Tapping is a great resource. So if there's any component of mental, emotional, or otherwise, which is every thought is a prayer, meaning everything is energy, and that energy can translate into the biophysiological function. So you're doing amazing with I love your approach. I love you. This is what I call holistic thinking. I believe what is needed here is to make sure that you've gotten to and you ruled out all the conventional causes or reasons why nausea might be in place. Once there's no more red flags, I call it red flags from emergency room perspective. In other words, there's not a heart attack, there's not an infection, and you know that it's nothing of that nature, then it becomes a question of balancing the body. Biogenics can be very helpful with that, but it could use a few other things, including supplements and otherwise. And of course, as I mentioned, consultation may be needed if that continues to be an issue. But wonderful. Thank you so much. Now, do you advise to use the Shealy Relax Mate with autogenic training? Yes. Thank you for mentioning that. The autogenic training, autogenic training, and there's another question that is present, and I'd like to address that right now. You don't have to just stay with autogenic training for the entire 3 months without everything else. In other words, it's not a requirement to do this alone with no other exercises for 2 or 3 months until you get it. But you want to continue to do autogenic training on a daily basis in order to entrain it. But as you do the autogenic training, you also want to do at least 1 or 2 other exercises alongside it with Biogenics. One of the most important, powerful adjuncts to autogenic training, to retraining of your central and autonomic nervous system, is something called the Shealy Relax Mates. And as a matter of fact, let me actually show you what that looks like. I'm glad we're getting this question here. Can I have glasses, please? I want to do a little demonstration with the glasses. No. Yeah. Okay, thank you. And I am back. Here we are. Relax Mates. Wonderful question. Love it. It looks cool in terms of glasses. So anybody with a sense of style will possibly appreciate this. But the thing is, I cannot see anything out of this because it's not like regular glasses. It has this additional layer. And what this does, I'll just demonstrate it. You may be able to see flashing lights. And of course, we can adjust the color as desired from reddish to bluish. And of course, we can adjust the intensity. And again, you do this with your eyes closed. In other words, I close my eyes and I put the glasses on. Now, the speed can vary. See, that's 1 cycle per second, 2 cycles per second, 3, 4, and so on and so forth, building up to 7 cycles per second. So what that does is it's called AVE, audio visual entrainment. Powerful stuff. Sound frequencies with autogenic training they have frequencies, binaural beats and gamma, which help to put the brain into a place of optimal healing, receptive to the good stuff. But there's something bigger than that, more important, more powerful, I should say, AVE, audio visual entrainment, by combination of lights and sound. So I would do this and the headphones, of course. You can actually put the brain into a much more relaxed state. And when you're relaxed, you can allow the healing, you can allow the learning. I highly advise that. And the Relax Mates are one of my favorite modalities. You can also use them to help fall asleep. For example, when you are, if somebody has insomnia, difficulty relaxing, that's a very powerful modality. You put it for 60 minutes. If you want to relax during the day, take a nap or relaxation, you can just do it for 20 minutes. Thank you. Okay, 1 time in the day is sufficient, AM or PM. Are we talking about are we talking about the Relax Mates, or are we talking about the autogenic training? If it's autogenic training, 1 time a day is sufficient. Twice is better, especially if there's a significant anxiety, depression, or stress component. And by the way, anxiety and depression is inevitable with enough stress. Our world is full of stress. So whether you do it in the morning or whether you do it in the evening, again, it's the point is, how do you learn best? Now, I'm not a morning person. I'm more of an evening person. I get up in the morning because I have to, but I really come to life and in the evening. So for me, in order to learn or to do something effectively, I would have to do it in the evening. But some people are best in the morning, and sometimes if you, for example, autogenic training and other exercises, you wake up with it and you go to bed with it. And it helps you fall asleep. I hope I addressed the right question there. Any other thoughts, questions, or I think we got a couple more, yeah. Last week, you showed a scalar. Can you talk more about that? Absolutely. Okay. Since this is a wonderful opportunity to show and tell, let me do that. Be right back. From last week's show on the radio, this is what the Shealy device looks like. You got the crushed sapphire, you got electronic component. Now it's unplugged, but this is where it goes in. And what you would do is you would put it facing you, and the Shealy device is one of the most effective ways to reduce free radicals, the scavengers that destroy the body. And it is, also affects blood flow. Platelets, when they aggregate, when they combine and they stick together, that's one of the ways that people get strokes, heart attacks, vascular issues, and vascular goes everywhere in the body. Could be kidneys, could be brain, could be heart. It's just a big question of which organ is affected most. So by improving the blood flow, by getting the blood cells to red blood cells to platelets to just flow easier, you improve circulation, you improve everything. But it also reduces free radicals, and it reduces something called adrenomedullin, which is, people are not aware of what that is. When the adrenomedullin is elevated, when it's high, that means you're either getting older or you're getting more stressed. And sometimes it's not a question of getting older, it's a question of what is the overall body stress, mental, emotional, physical, otherwise. So this is one of the best ways to reduce free radicals. It's the best way to reduce this stress hormone called adrenomedullin. And it's a very powerful, amazing modality. And actually, if you're interested, I would certainly look into that sooner than later, because we don't have that many more of these left. But I'm sure we'll get more of them in. But highly advise it. I've got one of these babies in right behind me in the office. Use it as long as I'm here. I have one in the bedroom. I have one in every room that I'm in for a regular basis. Great modality. Okay, next question, please. Okay. Well, it sounds like the questions are, I don't have any more specific questions. So let's just summarize and let's just talk about some general concepts that I'd like to kind of leave you with today. The idea, the concept is think natural, think holistic, think life, think health, think happiness, think self-regulation, control, think wellness. Wellness is a choice. And we are here to support your health and wellness. I'm not interested in supporting the disease process, disease. There's plenty of that in the conventional healthcare system. And when I go to the emergency room, I do that all day long. This is our opportunity to bring to you the idea, the concept that you can be healthy. And even if you're not fully healthy, you can reverse it. For example, we addressed today on weight, fluid, water balance, water retention, blood pressure. There are safe and natural and easy ways to actually control and work with all these things. Chronic disease. The idea is you can do this. You can do this naturally. You can basically be self-aware. Self-awareness is number one. In other words, to become aware of what's happening within the body, within the mind. Then you can make a decision. You can make healthy decisions. Not just a decision, but healthy decisions. That's the key. And of course, wonderful. PEMF. Thank you. I appreciate you. Wonderful. Be right back. PEMF. One of the most amazing devices, simple device, usually comes with a control box. 3 modes. The first mode is the scan mode, general scan mode. And the way I would wear this is, actually, I'll be right back. Actually, where's my, yeah, here goes. Very easy to wear, very easy to keep with you. And as a matter of fact, now you can have it battery charged. So you can, you're in the car, you can still do this. Now, that's all you got to do. 2 hours on the head, on the cranium, puts the brain into a gamma mode. What is gamma? Gamma is the in the zone. It's the, hey, I'm okay, I'm all right. And it's one of the stories, for example, one of the patient encounters is that I had with PEMF is one of the people, one of the clients, patients, and we have all sorts of patients. One of the things that we love to do most is get people off medications, especially antidepressants, and there's a lot of stuff with addiction, anxiety, stress. Well, it's a big bucket of all sorts of stuff. So this device has been shown to reduce cravings, addiction, and to the degree over 90% efficiency. Over 90% efficiency. The best that the best that you can obtain in one of the best case scenarios, literally, with centers that deal with addiction, is 17 to 20%. That's the best that you can get. You can get, and statistics-wise. This literally puts the brain into gamma. Gamma is the in the zone. When you're in the zone, not only does it allow you to think clearly, be at peace, be comfortable. Every kind of disease process is associated with some kind of a brainwave abnormality. Now, I'm not talking about seizures or things of that nature. We're talking about how do you function best? How do you optimize your being? How do you optimize your function, your thought process? Yeah, and life this is one of the ways. Pulsed electromagnetic field was discovered back decades ago. There's a number of really good books on PEMF, and there's various PEMFs around. This is the only one that works on generating gamma. The first mode is a general scan mode. It's based on the Schumann frequency. It's the basic Earth frequency multiplied by 7. There's 7 energy centers in the body. You can think of it in terms of chakras. For those who are familiar with energy medicine, those who are not familiar with energy medicine, and again, I don't want the word chakra to be a scary word. Again, it's not necessarily just a new age type concept. It's a wonderful concept of the energy centers. For example, the 5th energy center or chakra is actually a throat plexus. There's a number of nerves and nerve and nervous issue of all sorts in the throat. There's a cardiac plexus. There is a brain, which is one of the most effective, amazing organs in the body. That's another one of them. Solar plexus. There's many, and this cycles through all 7. That's the only one that does that. Others, there's many different examples. We compared PEMFs, including something called Beamer, which is much more expensive, and it doesn't do what this does. So the purpose is basically you could put it on your head. You can, if you have an issue, let's say injury to the shoulder, there you go. Just keep it there. Many different ways that this works. There's also a second mode, which is a gamma mode, specifically for the brain, for the addiction, for performance. And sometimes when I need inspiration or I'm like writer's block, I have several books out there, and I need some concepts and thoughts and just to clear the head. Boom, there you go. Do that for a couple of hours, and you feel fantastic. There's also a third mode, which is a sleep mode, which is, speaking of frequencies, Nikola Tesla has a very amazing quote. It's, if you want to understand the universe, think of energy, frequency, and vibration.
Yes.
All right, we're back on. Interestingly, when life gives you lemonade, it's you just, I guess, use the lemons, or life gives you lemons, make lemonade, vice versa. We were not able to have a radio show today because of the weather and all the interruptions, but it sounds like the internet is catching up with us here in the office, but we're back. So speaking about PEMF, quick essential summary, one of the most essential, powerful healing devices in the universe. Great for musculoskeletal injuries, great for brain, great for function, great for addiction. And I certainly recommend, this is just something that every household should have at least one of these, and every individual preferably, for health, for wellness, for cellular support, for the support of your of trillions of cells that make up who we are. We're made of trillions of cells. So take care of, the building blocks, and we'll be all right. And anything else? Thank you again. Wonderful question. Appreciate you.
Just say goodbye.
Okay. Well, I don't know if you can see me or hear me, but I think.
All right, we're back on.
Well, it sounds like the powers that be, especially the internet, wants us to stop for now. And I'll see you next time.
I don't know if you can see me or hear me.
All right. Take care.
End stream.